depression, brain regulation, and neurofeedback, and the implications for lasting change. If you're reading this, there's a good chance you've already tried reasonable things for depression. You may have done therapy seriously, taken medication thoughtfully, adjusted sleep, exercise, or diet, and still found that depression lingers in ways that are hard to explain. That experience is more common than most people admit, and it deserves to be taken seriously rather than minimized or reframed as a lack of effort. The purpose of this discussion is not to offer encouragement or philosophy. It is to explain what the research shows when depression is examined at the level of brain function, and why that research matters for people who want more than short-term relief. You see, over the past 2 decades, depression has increasingly been studied not just as a psychological or chemical issue, but as a problem of brain regulation. When researchers examine brain activity in people with depression, they consistently find patterns of underactivation, overactivation, and poor coordination across networks involved in mood, motivation, emotional recovery, and self-regulation. Neurofeedback was developed to address this level of the problem directly. It is a form of brain training that uses real-time information about brain activity to help the brain learn more stable and flexible patterns of functioning. The important question is not whether this approach sounds appealing, but whether it holds up under careful scientific testing. The research summarized here shows that it does. Across multiple independent studies, neurofeedback for depression has been evaluated using randomized controlled trials, clearly defined training protocols, and standardized outcome measures. These studies include EEG-based neurofeedback targeting frontal and beta activity patterns, as well as real-time fMRI neurofeedback targeting deeper emotional and regulatory networks, such as the amygdala and prefrontal systems. Importantly, these studies were conducted by different research teams using different methodologies and still arrived at similar conclusions. Neurofeedback produces meaningful reductions in depressive symptoms that exceed control or comparison conditions. Several studies directly compared neurofeedback to sham or control feedback, demonstrating that the benefits were not simply due to attention, expectation, or placebo effects. Others compared neurofeedback to treatment as usual and found higher response and remission rates when neurofeedback was included. In some cases, improvements were maintained months or even years after training ended, suggesting that the brain had learned a more stable way of regulating itself. This consistency across studies, methods, and research groups is what elevates the findings beyond promising or experimental. Let's turn to the question of what Level 5 evidence means and why it matters. In clinical science, treatments are evaluated on a hierarchy of evidence. Early levels include case reports, small uncontrolled studies, or findings that depend heavily on subjective impressions. At the top of this hierarchy is Level 5 evidence, often described as efficacious and specific. Level 5 evidence means several things. The treatment has been tested in multiple randomized controlled trials, not just one favorable study. The protocols are clearly defined and replicable. The outcomes exceed placebo or comparison conditions, demonstrating that the effect is specific to the intervention itself, and the results are measured using established clinical tools rather than anecdote or enthusiasm. As we can see, neurofeedback for depression meets these criteria. This matters because many approaches to depression feel helpful in the short term, but have not demonstrated durable, specific effects when studied carefully. Placebo responses, expectancy effects, and nonspecific support can all produce temporary improvement. When those factors fade, symptoms often return. Level 5 evidence tells us that an intervention works for reasons that go beyond belief or short-term support. In practical terms, it tells us the treatment is changing something real in how the brain functions. Why durability of change is a key finding One of the most important findings in the neurofeedback literature on depression is durability. Several studies followed participants after training ended and found that improvements persisted without ongoing treatment. This is uncommon in mental health research and is particularly relevant for people who have experienced cycles of partial relief followed by relapse. From a research perspective, durability suggests learning. The brain is not simply being supported while an intervention is present, it is acquiring a new regulatory pattern. This distinction matters when evaluating long-term outcomes. Understand, neurofeedback's goal is not to suppress symptoms, but to improve how the brain regulates itself. When regulation improves, mood, motivation, and emotional resilience often improve as downstream effects. How does this differ from symptom management approaches? Many conventional treatments for depression focus on managing symptoms rather than changing underlying regulation. These approaches can be useful, especially early on, but they do not necessarily teach the brain a new way to function. When the intervention is removed, the system often returns to its prior state. The neurofeedback research summarized here points to a different mechanism: direct brain training using feedback, repetition, and learning principles. This is why neurofeedback is increasingly studied not as an alternative belief system, but as a neurobiological intervention that can be tested, replicated, and refined. Why does this research matter for real people? For individuals who have tried reasonable treatments and still feel limited by depression, this body of research offers something specific and rare: a well-studied option that targets the brain systems involved in regulation and change. It does not promise instant results, and it is not presented as a cure-all. What it offers is a method grounded in neuroscience, supported by high-level evidence, and associated with lasting improvement for most participants. That combination is uncommon. So what is the next step? If you are considering neurofeedback, at Capital District Neurofeedback, our work is grounded in this research. We use evidence-based neurofeedback protocols and individualized assessment to determine whether this approach is appropriate for a given person. Our goal is not to replace thoughtful care, but to offer a practical, research-supported option for those seeking meaningful and lasting change. If you would like to learn more or discuss whether neurofeedback may be a good fit, I invite you to schedule a free consultation with me, Dr. Randy Cale. Please schedule through our website at capitaldistrictneurofeedback.com or call my assistant at 5186-063805. I look forward to speaking with you. Just remember, a better regulated brain is also a happier brain, and that life can be yours.